जी।
Good evening, everyone, and good evening, Dr. Deepak. Good evening, Dr. Shweta.
Good evening, ma'am.
So today's speaker, Dr. Shweta Singh, I know she also doesn't need any kind of introduction. Everyone over here knows her very, very well. She's a very known and highly qualified homeopathic doctor. And she has been a part of Orbit Clinic almost like you can say a decade. From 2014, she has been one of the core member of Orbit Clinic. And she has been running a clinic in Nangal, Raya. And but that's not the only thing that we should know about her. I would like to tell that she's working as a senior research fellow in Central, that is CCRH, and in Delhi branch she's working. And her main emphasis is on drug de-addiction. She's a well-experienced teacher as well, and she has been working as a associate professor in the Department of Organon in some reputed medical colleges. So I know hearing from her would be a great privilege for all of us. So I'll hand over the mic to her without wasting much time. So Dr. Shweta, over to you. Please go ahead.
Thank you so much, Dr. Shilpi and Dr. Deepak, for giving me this opportunity to share my experiences in hair fall and homeopathy. Let me share my screen. Please allow me to share my screen, please.
Yes, already allowed, ma'am.
Sir, नहीं है.
जी, आपको क्या देखिए?
No, sir. Same.
Okay.
Yeah.
Yes. Minister, yeah, please. दोबारा करिए.
Is it visible?
Yes.
Yes, yes.
Yes. So today we will discuss about hair fall, which is a branch of skin, dermatology, and homeopathy. Now, the facts about hair fall. Hair fall is the synonymous terms are alopecia and baldness. The normal growth cycle of hair follicles, we all know that it has 4 phases. One is the growing phase, anagen. The short transitional phase, that is catagen. Resting phase is known as telogen. And falling out of hair, the phase is known as exogen. After that, a new hair start growing in the follicle and beginning the cycle again. So this total growth cycle of hair follicle is basically 28 days, where the hair grows up to 1 centimeter. Normally, people have between 1 lakh to 1.5 lakh hair strands on their head, and the number of hair strands normally lost in a day varies, but on an average we lose around 40 to 100 hairs each day. Then they reach the end of their resting phase and fall out. And in order to maintain a normal volume, hair must be replaced at the same rate at which it is lost. So अगर 40 hairs to 100 hairs हम lose कर रहे हैं, तो again वो recycle उतने ही hairs हो जाएंगे to maintain the normal volume of the hairs. But when we lose more than 100 hairs per day, clinically we term it as hair loss or telogen effluvia. If there is disruption in the growing phase, which cause the abnormal loss of hair, it is known as anagen effluvia. And if there is more excessive falling of hair and the resting phase is long, then it is known as telogen effluvia. The first and foremost sign basically of hair fall is when we notice that more hairs are in our hairbrush or in the basin after we shampoo, or on the pillow after resting or sleep. The types of hair loss: first is pattern baldness, or androgenetic alopecia, which is basically inherited or genetic baldness. Maybe it is a male pattern. It is also known as male pattern baldness or female pattern baldness. In the males, there is receding hairline, there is thinning around the crown area, which eventually leave, there is eventual bald spots you can see. There is horseshoe ring of hair which appear around the sides. And in the female part, basically there is no, the complete hair loss is rare. There is thinning of hair, and it is due to the genetics, due to the age, or due to increase of the male hormones in the females after menopause. Second is alopecia areata, which is an autoimmune disease where our own immune system attacks the hair follicles. You can see the bald spots on scalp, beard, eyebrows can be fall out, eyelashes can be fall out. But because in this alopecia areata, hair follicles remains active, so there is potential to regrow the hairs with the help of homeopathy. And but you have to work on the causes, because of those causes which are causing hair fall. In the advanced cases, you can also see a complete hair loss of over the scalp, which is known as alopecia totalis. And when there is complete hair loss from the body, it is also known as alopecia universalis. Then third is tinea capitis, which is because of the fungal infection. There can be hormonal hair loss because of thyroid hormones imbalance of thyroid hormone. It can be because of the imbalance between the estrogen or androgens. So some women may experience hair loss after parturition, or during the lactation period, or even during their pregnancy period. So this is because of the hormones. We have already discussed telogen effluvium and anagen effluvium. So in the telogen, there is temporary hair loss, which can be because of some serious illnesses, acute illness, or some fevers, prolonged fevers, because of some major surgeries, because of some emotional or physical stress. In anagen effluvium, they can be because of the radiotherapy or due to the chemotherapy in cancer patients, where there is the therapies affect the actively growing hair follicles along with the fast growing cells, cancerous cells. Cicatrial or scarring alopecia, when there is inflammatory damage of the hair follicles and it replaces it with the scar tissue. So if the inflammation destroys the sebaceous glands or the stem cells, the hair loss is permanent. So we cannot do anything in those cases. Then trichotillomania, which is a psychological disorder where there is a strong urge to pull out his or her own hairs. Then the causes of hair fall, it can include the hereditary or genetic factors, the imbalance of hormones, infections, skin infections like tinea, psoriasis, eczema, dandruff can be the cause, pregnancy or childbirth, drug abuse and excess of cosmetics on the hairs, terminal illnesses, the therapies like chemotherapy or radiation therapy. Obviously, poor nutrition can be one of the cause, or unhealthy eating habits, and other factors which includes pollution, water quality, air quality, or other toxic products or the environment. Now let's discuss the remedies which can help us in treating these cases of hair falling. In the hair baldness, there are many remedies mentioned in our repertories, Kent repertory, synthesis. You can refer any of the repertory. These are the few remedies which are mentioned in the repertories. So we can take it one by one. In the baldness, there is a first grade remedy is mentioned, brighter carb. So let's discuss this remedy at first. Brighter carb, if you see the rubrics, brighter carb is mentioned in baldness of young people. There are only two rubrics mentioned in the baldness of young people, that is brighter carb and silesia. So first, brighter carb, which can be of help in the baldness cases of young people. Then brighter carb is also mentioned in hair falling, in the vertex area. So you can prescribe brighter when there is baldness or hair falling in young people and affected the vertex area. And you also know that brighter carb is also, there is affection, glandular affections are more in brighter patient. Second remedy is silesia, which is also an important remedy in the baldness cases of young people. Then we all know that silesia is a chilly patient, especially affecting hair falling in the forehead or occiput region. There is profuse sweating of the head. So hair falling with the profuse sweating over the head, which is offensive in odor and which extends to the neck region. You can also see offensive sweat on the feet, hands, and axilla in silesia patient to differentiate your remedy with the other remedy. And also, if the hair falling is after the vaccination, you can think of this remedy. Then the next remedy is phosphorus. Phosphorus, if we see the repertory, it is the main remedy which is coming in the baldness, in the hair falling, in the baldness in spots, in patches. We all know that phosphorus is the most common remedy in the cases of commonly used medicine in the case of hair falling. Then with the dryness of hairs, it is also given in the dryness of hairs, ailments after cutting hairs. Then the hairs are coming in handfuls. So it is covering all the symptoms. It is in baldness. The hair comes in large bundles from the forehead and sides above the ears. Then baldness in patches or single spots, round patches on the scalp, violent itching of the scalp, and the dandruff, which is white in color, which is profuse, and the hairs falls out in bunches. So the main remedy for this kind of presentation of symptoms is phosphorus. Then the next remedy is fluoric acid. We all know fluoric acid is a hot syphilitic patient. When the hair falling is accompanied with itching, lot of itching of scalp and offensiveness, the patient is better by cold, worse by warm, and there is premature old age. The patient is looking prematurely old. Fluoric acid is a syphilitic remedy, so you can also expect complete baldness in patients who need fluoric acid. There is itching. The new hair is basically dry, breaks off, and falls out. We can also think fluoric acid after typhoid fever or typhoid-like fevers. And the patient has to comb frequently. It mats. The next remedy is vinca minor. Vinca minor is also, vinca minor patient have also itching of scalp. There is patches of baldness. There is eruptions, there is spots on the scalp with oozing moisture, and the hairs are matted together in these cases. So bald spots with lot of itching, oozing moisture, which is followed by matting of the hairs, and which results in hair loss. The characteristic is symptom of vinca minor is after hair loss, when there is regrowth of hair, the hair comes are gray in color. So bald spot हुआ, उसके बाद जब रीग्रोथ हुई तो वो जो बाल है उसके वो ग्रे आएंगे. So this is a single remedy which helps in such cases. It is given in repertory in the as a hair comes in gray color after hair loss. The next remedy is Arnica montana, which is a, we all know that is a this remedy is a muscular tonic. So hair falling after shock. It can be physical, it can be emotional. It can be because of some financial loss. So we can think of if the hair falling is because of any mental strain or shock, we can think of arnica. The next remedy is phosphoric acid, acid phos, where there is history of grief, disappointment, sadness, homesickness. And acids, we all know there is debility. The main symptom of acids is debility, which can lead to hair fall, which can lead to premature graying of hairs. So the hair fall is followed by any acute disease in phosphoric acid. It can be because of any prolonged fever after typhoid, after any grief, after loss of vital fluids. And it is a wonderful remedy we have used in post-COVID hair falling. One of the case I want to show the results with phosphoric acid is this. So this patient is had COVID, and after that she lost her hairs, and I gave her acid phos 30. Are in front of you. The next remedy very commonly used in hair fall cases is natrum mur. We all know that there is complaints after chronic grief, fright, anger. We can find dry, crusty eruptions on margins of hairy scalp with hair fall. There is a lot of itching of the scalp, which extends up to the nape of neck. Hair falling, which aggravates after touch. So whenever the patient touches her hair, there is a lot of hair falling, mainly on the forepart of the head, temple region, and beard. The scalp of natrum mur patient is extremely sensitive. The hairy parts are greasy and oily. So in the cases, it is a great remedy in of hair fall in anemic patients, or the patient who have disturbances of alimentary tract or skin infections. We all know natrum mur is a very sensitive patient, emotionally very sensitive, and she has a lot of love for her near ones or dear ones. And consolation aggravates, we all know the mental sphere of the remedy. So we can match the mental sphere and these particular symptoms with the patient and prescribe it. The next remedy is sepia, where there is chronic headaches with hair fall. We can think of sepia. The roots of the hair are very sensitive. There are pimples on forehead, near hair. And we all know about the indifference of sepia. There is lack of emotions, there's no joy, weepiness. While telling her symptoms, there is grief, but indifference is the main symptom. Sepia is a remedy which we can, which also always comes in our mind when there are complaints after pasteurization. So whenever a lady comes after her delivery and she says that I have hair falling, which started after delivery. So the first remedy which came to my mind is sepia, where we can have we can match more symptoms like cross-leg position of sepia to avoid that prolapse sensation, bearing down sensation. There is said like brownish discoloration around the nose and cheeks. So we can think of sepia. Just a second. Sorry. Yeah. Now the next remedy is lycopodium, where the hair falling is from the vertex area or the temples. The characteristic symptom is whenever you find a patient with hair falling after abdominal diseases or complaints. This is a single rubric remedy in the repertory. It is a first grade remedy in hair falling after perturbation, and you can see premature baldness and graying of hairs along with dandruff in lycopodium patient. There is deep furrows on the forehead, which is characteristic of lyco. Now in the repertories, there are 3 more remedies which are mentioned in hair falling after exhaustive diseases. One is carboveg, the second is thallium, and one is mancinella. So in carboveg, there is lot of itching in the scalp with hair falling when getting warm in bed. There is general weakened condition with the hair falling. And we all know that carboveg patient got relief after fanning. In thallium, which is a metal, thallium metallicum. So the complaints coming post-exhaustive diseases like fevers, typhoid, or any of the post-exhaustive diseases like post-COVID, COVID also. This remedy has specific actions on the endocrines. We have read the causes of diseases. There we discussed about hormonal disturbances, disturbances of thyroid hormones, disturbances of adrenaline. So if it is there, this remedy has influence on the endocrine, especially thyroid and adrenaline. So if the patient has such disturbance, we can think of this remedy. Next remedy is mancinella, which we can think after exhaustive disease, the third remedy, which is mentioned in the repertory. But it can be think of when there is depression with hair loss at the age of puberty or at climacteric during the menopausal stage. And you can find hypersexuality in these patients, which is mentioned by which is mentioned in herring guiding symptoms. So if you find hair loss with depression, you can think of mancinella. And if there is hair loss without depression, you can think of thallium. Next wonderful remedy is Pilocarpus microphyllus, which is also known as jaburandi, which is a hair restorers. It is basically when there is hair falling with dryness of scalp and dandruff, we can think of jaburandi, but the rest of body perspires profusely. So scalp dry milega, but rest of the body profusely sweating hogi. Then we can think of jaburandi. It can be also think of in the menopausal stage when there is the patient complains of hot flushes. This is a wonderful remedy when hair falling is accompanied with hot flushes, can be accompanied with salivation, and there is profuse perspiration except head. The other remedy is HYPERACIDITY, which is also known for the sensitiveness because of the painful scalp. So the HYPERACIDITY patient has hair falling with eruptions which are very much painful, that the patient cannot bear anything touch her or his head or comb hair because of that extreme sensitiveness. There is burning and itching from a humid scalp. The pimples or eruptions can be extremely sore and significant baldness on the significant baldness area of the head. And the patient sweat coldly. The next remedy is selenium, where there is hair falling when the patient comb their head. Hair falling can be from the brows, from the beard area, or from the genitalia. Selenium patient, the characteristic of selenium patient is hair falling with extreme sensitiveness and aggravation from touch. The scalp is extremely painful. It can also be think of in debility after exhausting diseases. In selenium, the patient complains of loss of sexual power, but there is increased desire. There is much itching in the scalp. The patient bleed after scratching. And there is emaciation of face and hands. Now, sulfur, a very well-known remedy. You can see hair falling with a fungal infection. Tinea capitis can be there, which is dry in form. Sulfur is known for the dryness. Sodic remedy. There is falling of hair, which is worse by washing. There is itching, burning after scratching. So if such dryness is there, fungal infection is there, or this burning after scratching, you can think of sulfur. Arsenic album, there is a lot of itching in the scalp with circular patches of bare spots, which is rough, filthy, balding. There's dry scales. There's a lot of burning. Burning is characteristic of arsenic album. There is itching, dandruff, and aggravation is at night. Scalp is quite sensitive and the patient is unable to brush his or her hair. Next remedy is graphitis. When the hair falling is especially from the vertex area, then we can think of graphitis. There is humid, itchy eruptions on the hairy scalp, which is very emitting a fetid odor. So there is itchy eruptions, humid, itchy eruptions with offensiveness. There can be rheumatic aches in the scalp, particularly in the sides, and which is radiated to teeth and cervical glands. And the basic constitution of graphitis is the patient is fat, the patient is very much chilly and constipated with delayed menstruation. So there can be hormonal disturbances also. Next remedy is Sionothus. We all know that it is a liver tonic, and it is uh, used when there is the fault is at spleen or liver. So it can be given because of in the cases where the patients are anemic, which is due to the spleen or liver. So hair fall with anemia, where spleen and liver are at fault, we can think of this remedy, Sionothus. Other wonderful remedy where the alopecia is accompanied with intolerable itching, and the patient itches until it bleeds. We can think of Pix liquida in those cases. One more wonderful remedy for the cases of hair fall is Wisbaden, in which hair grows much more rapidly than usual. It falls out and grows again rapidly. So there is rapid growth of hair, but hair falling is too much. And the new growth is darker, which is formerly soft. It becomes brittle. It becomes hard. The hair becomes brittle and hard afterwards. You can find large boils and desquamation in these patients on the scalp. There is itching as from vermin, which is very intolerable and incident. Then the remedies. I want to show some rubrics which have single remedy and which can also be useful in cases of hair falling. One is when the hair are bristling, and whenever the patient coming in open air, the hair bristles. That is ammonium carb. Then when the hair changes color, kali iode. When the hair becomes curly with baldness and जो भी new growth हो रही है वो curly आ रही है, then we can think of mesothelium. I've already told you the hair falling after abdominal diseases. Lycopodium is the single medicine mentioned in repertories. Then we have already discussed these remedies for hair falling after acute exhausting diseases: carbovage, mancinella, and thallium. Then hair falling from grief. The single remedy is phosphoric acid. Hair falling with lot of hair coming out in bunches, in handfuls. The main remedy, first grade remedy, is phosphorus. We can also think of lycopodium, mesothelium, and sulfur according to the symptomatology. Then hair falling in the menopausal stage. We have already discussed the sepia is the main remedy which comes to my mind after parturition, but this is mentioned in single rubric at the stage of menopause. Hair falling during pregnancy. The single remedy mentioned is lachesis, which has melancholic disposition, which hair falling because of the ill effects of suppressed discharges, and the patient is better by appearance of discharge. There is great loquacity. We can relate these symptoms. Then the single remedy, when the hair falling, when there are bald spots and the hair comes in white. The single remedy is vinca minor, which we have already discussed. Then these are the remedies differentiated according to the location of baldness. Then hair gray, but in spots. The single remedy mentioned is sorinum. Hairs are painful with falling of hairs. Entim crude is the single remedy. Then hair sticks together. And at the end, it is borax. Hair tangles easily. We can think of borax, fluoric acid, graphitis, sorinum, veratrum, vinca. If there is thinning of hairs, we can think of tuberculinum, magnesium silicata. Then the remedies for dandruff. If the dandruff is accompanied with lot of itching, only medurinum is mentioned for those cases. If the dandruff is white in color, then we have thuja, we have natramure, phosphorus, we have already discussed, mesareum. And if the dandruff is yellow in color, the remedy is kali sulf. So for dandruff, kali sulf. For yellow dandruff, which is moist and sticky, there is bald spot on the left side of the head. Also, it can be on the beard area. The complaints hair falling after gonorrhea. The kali sulf is the remedy. Then thuja, which has white scaly dandruff. Hairs are dry, falling out, and there is greasy skin of face. Then one more remedy for dandruff, that is cantharis. Hair falling, when the patient combs his or her hair, then hair falls out. This remedy can be think of especially during confinement. If the hair falling is during confinement or during the lactation period, we can think of cantharis. There is scales on scalp and there is enormous dandruff. Next remedy is cochlearia or moracia, which is also used locally to cure dandruff. The hair loss can be accompanied with sinusitis symptoms. So if the patient is complaining of hair loss, he or she has sinusitis along with that, and there is a lot of dandruff. So we can use this remedy locally also. These are the symptoms I have taken from Clark prescriber, and where it is mentioned in hair dryness, we can think of Kalika 6, and we can give it in repetition 6 hourly. If there is falling of hair with dryness, we can think of Kalika. If there is falling of hairs, fluoric acid can be think of, fluoric acid 6. If there is falling of hair falling with depressing emotions, phosphoric acid 1 mg can be given. If there is falling off with humid eruption and scalp is very sensitive, we can think of nitric acid. If there is baldness, we can think of arnica 1. If there are greasy hairs with hair falling, we can think of Bryonia 1. And for dandruff, it has mentioned arsenic. Moist dandruff is there. Then we can think of sepia 6. We can prescribe it 6 hourly. And if the dandruff is thick, then we can think of sulfur 30. And he has also advised to use mild sulfur ointment at the same time. So both internally and externally for rapid results. Then if there is a complaint of head lice, he advised the hair to be washed daily, and after each washing to be bathed with the lotion of Sebidilla Q. So we can use Sebidilla Q for washing of hairs in the cases of head lice, and internally we can give Natramure 6 4 hourly. Thank you. So definitely we have to use constitutional treatment in the cases of hair falling, dandruff, or any of the case. But sometimes when the constitutional remedy fails, we can use these lesser known satellite remedies to relieve our patient. That's all from my side. Thank you so much for patient listening.
Okay. Thank you, Dr. Shweta. There is one question for you in the chat box by Dr. Abhishek Duggal. He asks that sometimes we find vitiligo patient who has few white hairs on eyebrows or mustache hair, and they become white, or other location parts hair on legs and patches become white. What may be the remedy here, and what is the prognosis to be delivered to the patient? Next, he continues, can Vinca minor be given in this case? Because Vinca minor, as you said, that it is having patchy baldness and patchy white graying of the hair. So maybe that's why this question has come up.
So if it is a case of vitiligo and it is not a case of hair falling, we can differentiate it with other remedies. But if it is probably a case of hair falling where we can find कि baldness है, patches में है, और वहां पे अगर growth आ रही है तो वो white आ रही है सिर्फ वहीं patches में, और कहीं कोई spot नहीं है, we can think of Vinca minor in that case. Definitely, if it is primarily affecting the scalp area, it can be vitiligo. We can think of Vinca in those cases.
Okay, ma'am. Thank you.
One more question. Hair fall in bunches every time she combs and touches her scalp after hysterectomy. Can sepia be considered in this case?
Yes, we can think of sepia, but we should match other symptoms also. With the personality of the patient, we have to match that remedy to, yeah.
Yeah. So basically, see, these are the symptoms which you have told. Until unless we match with the mentals and we match with the other physical generals, any medicine can be thought of, any medicine can be prescribed.
Like we have lot of remedies where there is hair fall in bunches. So
Yes,
at least we have to differentiate those remedies with the symptoms of our patient. Then we can select one. We cannot prescribe all the remedies to the patient at one time. No? So we have to differentiate those remedies at least. So I can't say sepia should be given to this patient after hysterectomy, because I haven't read this symptom in any repertory or in any materia medica book. But yes, hair fall in bunches, if it is matching with, there is hormonal disturbances, definitely if she undergoes this hysterectomy, there can be hormonal disturbances. And we have to see what is the personality of the patient, what is the mental sphere of the patient. Then we can think of sepia or phosphorus or any other remedy.
And Sanicula can also be given in hair loss.
I have no idea about Sanicula in hair loss. Sorry. I'll read this and will tell you, Abhishek.
Okay, ma'am. But usme Sanicula is like prepared from some mineral water. It is a
Okay.
kind of mineral water. So sometime I have given it in 1 or 2 cases. Like जब कैल्शियम मैग्नीज ये सब चीजों की कमी होती है तो
Okay.
तब हेयर लॉस भी तभी हो सकता है, एक कारण मान सकते हैं. तो इसमें मैंने दिया था. बाकी एक वीज बेटन आपने बताया, ये तो एक जनरल रेमेडी हम देते हैं कॉमन.
बिल्कुल.
हाँ जी. Yes.
Any other question from anyone? Ma'am, please tell about Weisbedden for hair fall. It's basically more inputs about Weisbedden. Maybe they're asking.
विस्बेटन एक्चुअली मैंने बहुत यूज किया है इन केसेस ऑफ हेयर फॉल, एंड बिकॉज इट इज लाइक अ हेयर टॉनिक. मैंने बताया ना कि हेयर जो है वो बहुत रेपिडली ग्रो करते हैं. बेसिक मतलब होता है हेयर फॉल बहुत ज्यादा होता है, लेकिन ग्रोथ भी उसके अकॉर्डिंग रैपिड होती है इन केसेस ऑफ विस्बेडन. सो आई यूजुअली, मैंने बहुत यूज किया है विस्बेडन 30 इन द केसेस ऑफ हेयर फॉलिंग. इससे ज्यादा मुझे इंफॉर्मेशन विस्बेडन के बारे में नहीं मिली. देयर इज इंटॉलरेबल इचिंग विद हेयर फॉलिंग एंड देयर इज रैपिड ग्रोथ इन द केसेस. बाकी अगर मुझे डेफिनेटली और कुछ भी मिलेगा तो मैं जरूर शेयर करूंगी.
Can Chininum ars be thought after prolonged sickness and hair fall after that?
सर डेफिनेटली अगर प्रोलॉन्ग सिकनेस है, चिनियम आर्स फीवर के एग्जॉस्टिव फीवर्स के केसेस में दी जाती है फॉर द वीकनेस, और वहां पे अगर हेयर फॉलिंग भी है तो यू कैन थिंक ऑफ दैट रेमेडी. बट मैंने 3 डिस्कस किया है बिकॉज मुझे रेपर्टरी में वो 3 रेमेडीज जो मिली हैं आफ्टर एग्जॉस्टिव डिजीज, सो मैंने वो 3 वहां डिस्कस किया है. हमारी मटेरियल तो इतनी बढ़िया, हम कहीं से भी कुछ भी मैच करके ऑब्वियसली दे सकते हैं. वी हैव टू फाइंड दैट इंडिविजुअलाइजेशन ना. सो वी कैन थिंक ऑफ, ऐसा नहीं है कि हमें सिर्फ वहीं स्टिक कर जाना है कि ठीक है रेपर्टरी में तो 3 मेडिसिन दिया हुआ है, लेकिन हम वो हमारी जो नॉलेज है वो रेपर्टरी तक तो सीमित नहीं रहेगी ना. हमारी लिमिटेशन तो है ही नहीं. अगर हम इंडिविजुअलाइज करने की बात करें तो हमारी मटेरियल इतनी वास्ट है कि हम कहीं पर भी कोई भी मेडिसिन ऑब्वियसली अगर हमारे दिमाग में आया और हाँ वो चीनियम आर्ट्स से मैच कर रही है आपकी मेडिसिन, ऑब्वियसली प्रोलॉन्ग सिकनेस के केसेस में हम चीनियम आर्ट्स सोच सकते हैं. बट वो हेयर फॉलिंग में काम करेगी, वीकनेस के लिए डेफिनेटली काम करती है. आई डोंट नो कि हेयर फॉलिंग में काम करेगी या नहीं बिकॉज वो मेंशन नहीं है, रिपोर्टरीज में नहीं है, बट हाँ कर सकती है.
To grow mustaches, some patients use Jaborandi mother tincture. This is information only, ma'am. Can you throw a light on this?
बिल्कुल, पाइलोकार्पस तो यूज होता ही है, हेयर रिस्टोरर्स ही है बेसिकली. वो हम ऑलरेडी डिस्कस कर सकते हैं. जबरेंडी तो सबसे ज्यादा यूज होने वाली मेडिसिन है. मुझे लगता है कि हर एक लेमैन को पता है जबरेंडी का नाम. तो सो इट इज अ वेरी वास्ट कॉमनली यूज्ड मेडिसिन इन द केसेस ऑफ हेयर फॉलिंग.
Yes, Dr. Deepak, you have to say something.
जी, थैंक यू डॉक्टर श्वेता, इतना सब कुछ अच्छा बताने के लिए, और कुछ नई मेडिसिन के बारे में भी आज पता लगा. तो जहाँ तक हेयर फॉलिंग की बात है, तो सिर्फ हेयर फॉलिंग के लिए तो मेरे पास पेशेंट थोड़े कम आते हैं, क्योंकि जो लोग हेयर फॉलिंग को लेकर के भी आते हैं वो कहते हैं डॉक्टर साहब आप ही खुद के नहीं है तो मेरे हमारे क्या ठीक करोगे, तो ज़्यादातर तो वापस हो जाते हैं. तो जहाँ तक हेयर फॉल की बात है, देखिए हम लोग काम करते हैं बहुत सारी ऐसी डिजीज के ऊपर जहाँ पर हेयर फॉलिंग जो है वो पर्टिकुलर केसेस में आती है. तो जब भी कभी हेयर फॉल का केस आए तो आपको ये जरूर समझना चाहिए कि आखिर वो हेयर फॉल एकदम से आया क्यों. या तो ऐसा है कि कोई उसको जो प्लेस है वो कहीं चेंज ना हुआ हो, कहीं उसका जो पानी है वो कहीं चेंज ना हुआ. आज की डेट में जो शैम्पू और जो ऑयल है और पानी है, ये 3 मेजर फैक्टर हैं हेयर फॉलिंग के लिए. इसके बाद पॉल्यूशन या स्ट्रेस या बाकी सब चीजें आती हैं. अगर आप हेयर फॉल के सिर्फ इस कॉजेज के बारे में बात करेंगे तो मोर देन 100 कॉजेज नोटेड हैं बुक्स के अंदर जो हेयर फॉल के कॉजेज में आते हैं. दूसरी बात यह है कि जो लोग भी अभी हेयर फॉल पे काम कर रहे हैं उन सब लोगों को ये पता है कि आगे आने वाले कुछ सालों के अंदर शायद हेयर फॉलिंग बहुत कॉमन हो जाएगी. और हो सकता है कि अब से 40 साल बाद 50 साल बाद सब लोग बिना हेयर्स के ही पैदा हों और उनके हेयर्स ना हो. ये बहुत ही कॉमन है और ये इवोल्यूशन का एक प्रोसेस है. क्योंकि अभी हमारे बालों का कोई काम रह नहीं गया, मतलब हमारे बालों का सिर्फ कॉस्मेटिक पर्पज के अलावा कोई भी यूज नहीं है. मतलब हम सिर्फ अपना कॉम्ब कर लें, हम अलग अलग डिफरेंट स्टाइल बना लें, हम लोग उसमें कुछ क्लिपिंग कर लें, इसके अलावा बालों का इस समय आज की डेट में कोई भी यूज नहीं है. और जहाँ पर बालों का यूज हो रहा है वहाँ पे हेयर फॉलिंग भी कम होती है. तो हम लोग अपने हेयर्स को सिर्फ एक कॉस्मेटिक पर्पज के लिए यूज करते हैं. ऐसे बहुत सारे पेशेंट हैं जो डिफरेंट डिफरेंट कॉस्मेटिक ट्रीटमेंट लेकर के आते हैं और कहते हैं कि हमारी हेयर फॉलिंग उसी के बाद शुरू हुई. जैसे बहुत सारे लोग स्पा लेकर के आते हैं उनके बाद उसकी हेयर फॉलिंग शुरू हो जाती है. तो जैसा भी अभी डॉक्टर श्वेता ने बताया कि उनकी सबकी डिफरेंट डिफरेंट मेडिसिन हैं. तो ऐसी नेट्राम्यूर जो है वो भी अपने आप में एक स्पेसिफिक रेमेडीज है. एसिड म्यूर भी बहुत स्पेसिफिक रेमेडीज है, लेकिन आपको ये फाइंड आउट करना पड़ेगा आखिर क्यों हेयर फॉल हुआ है. ऐसे भी बहुत सारे हमारे पास पेशेंट आते हैं जो मॉडलिंग की तरफ होते हैं, या वो कहते हैं कि डॉक्टर साहब हम इस पानी रोक सकते हैं, हम अपने जो हेयर ट्रीटमेंट है उसके लिए हम थिनिंग कराएंगे, आप हम उसको हीट भी करेंगे. हमने उसकी डिफरेंट डिफरेंट स्टाइल बनाए, जैसे मॉडल्स वगैरह करते हैं, तो ऐसे बहुत सारे लोग आते हैं, तो हम उनको साफ मना करते हैं कि आपकी हेयर फॉलिंग कभी नहीं रुक पाएगी, क्योंकि आप लोग अपने हेयर को अपने आप ही डैमेज कर रहे हो। प्लस सबसे मेन बात है कि अब हेयर का कोई काम नहीं है हमारी बॉडी के ऊपर, जो भी काम था वो उसके लिए बाकी सब चीजें इंस्ट्रूमेंट्स बने हुए हैं। तो हेयर सिर्फ एक कॉस्मेटिक पर्पज है। जो लोग अच्छा ट्रीटमेंट कर रहे हैं वो सब लोग सिर्फ उनकी डिजीज का ट्रीटमेंट कर रहे हैं जो इंटरनली हुई है। अगर कॉमन है, मान लो जस्ट डाइट भी नॉर्मल है, इन्वेस्टिगेशंस भी नॉर्मल आ रही हैं, बाकी सब चीजें भी ठीक आ रही हैं, तो वो हेयर फॉलिंग रोकना थोड़ा मुश्किल हो जाता है। और खासकर जहाँ से एक बार परमानेंट बाल गायब हो गया या हेयर फॉलिकल गायब हो गया, तो वो तो बहुत ही मुश्किल है ठीक होना। और मेरा थोड़ा ये कम काम है, मतलब कहते हैं तो कि लोग भाई मेरा हेयर फॉलिंग भी सर इसी में कंसिडर कर लेना। तो हम जो भी हमारी उनकी मेडिसिन आ रही होती है बस उन्हीं पर रिलाई करते हैं, उन्हीं से जनरली ठीक हो जाती हैं। जो अच्छी मेडिसिन हैं उसमें डॉक्टर श्वेता ने ऑलमोस्ट सारी मेडिसिन बताई दी हैं। जो मुझे अपनी मेरी फेवरेट रेमेडीज हैं वो पूजा नेटाम्यूर, ये सबसे फेवरेट रेमेडी है, दो रेमेडीज मैं ज़्यादातर यूज करता हूँ अगर हेयर फॉलिंग के लिए केसेस आते हैं तो। सो दिस इज फ्रॉम माई साइड, डॉक्टर शिल्पी।
Yeah. Thank you, Dr. Shweta. Thank you, Dr. Deepak, for the information on hair fall. I think this is one of the disease which is very commonly found. कोई भी पेशेंट आता है वो एक सिम्टम जरूर बोलता है, चाहे वो आया गैस्ट्रिक के लिए हो, चाहे वो आया लेग पेन के लिए हो, वो ये जरूर बोलता है और हेयर फॉल भी हो रहा है डॉक्टर साहब। तो इसलिए we have to differentiate whether we have to concentrate on hair fall or we have to see the other symptoms first and then along with that think of hair fall as well. So
Yes.
there was one more question from Dr. Parvati. Ma'am, in transplantation conditions, especially backside baldness, do we have any scope?
Uh, as Dr. Deepak mentioned, that we have to work upon the causes. We have to see what is the cause behind this baldness, if it is genetic, or if or is there any other cause of that baldness. So it depends on that, uh, if we have that scope or not. I've already mentioned the hair falling on the or baldness on the occipital area. So you can think of, you can choose from differentiate those remedies, and you can obviously try.
Fine. Anything else?
किसी को अगर कोई भी कंफ्यूजन है हेयर फॉलिंग के बारे में तो हमसे बाद में भी पूछ सकता है। और जहाँ तक हेयर फॉल का बात है, बहुत ही मतलब बहुत ही कॉमन है, बहुत सारे लोग इस पे अलग अलग मेडिसिन को यूज करते हैं, जैसे अभी जेबोरेंडी की बात हुई, बेस्बिटाइन की बात हुई, बहुत कॉमन है। लेकिन इनकी पोटेंसीज जो है वो बहुत संभाल के यूज करिएगा, मतलब मेरा जितना एक्सपीरियंस है। और कभी भी कोई फेक प्रिस्क्रिप्शन मत करिए किसी भी हालत में, चाहे वो पेशेंट ठीक ना हो कोई बात नहीं है, लेकिन फेक प्रिस्क्रिप्शन नहीं करने चाहिए। थैंक यू।
Fine. Thank you, Dr. Shweta. Thank you,
Thank
Dr.
you so
Deepak.
much, Manoj.
थैंक यू। थैंक यू मैम।
Thank you, sir.
Yeah.
Shall I end the meeting, Dr. Shilpi?
Yes. Yeah.
Okay. Thank you. Thank you, Dr. Shweta. Thank you, Dr.
Thank
Shilpi.
you, sir.
सभी लोगों को नमस्कार।
Yeah.